Now, one of the areas of the body that's affected a lot with people who do CrossFit workout is the shoulder. And so we're going to show you how to do laser treatment around the shoulder to help the joint itself, and also some of the thoracic spine that can cause issues with how the shoulder moves because of its tightness. So Josh, what are some of the things that people will do in with CrossFit that they may feel some problems with the shoulder?
Yeah, poor overhead squat, which would lead to a poor snatch, and putting the shoulder in a compromised position, trying to get as low as they can. That would definitely put a lot of stress on the shoulder. High repetition workouts with push presses, jerks, anything overhead really could put a lot of stress on it. And then even tons of push-ups, if not done properly, could aggravate the shoulder a lot.
I'm going to show you how I do it from a side lying position. It's a little bit more effective, be able to reach where you need to go. So you can see that he's got some tattoos here as well, and you can use the laser over the tattoos. You may have to move a little bit faster when you go over them because the ink will absorb some of the light. It's safe to use over it, but it may get a little bit warmer when you go over it. So when I treat a general shoulder, I'm going to go and I'm going to support myself from the back here, so I can put some good amount of pressure in the front, so there's counter pressure, so if I push back like this, he doesn't roll. Okay? Then I'm just going to use the laser and go right around the front in the anterior capsule, right by the pec minor, which is a big issue on people, in the bicep tendon, bicipital groove, right over the deltoid. And then I can switch hands and then come around the back edge and now get behind the shoulder and hold into the front, okay? And come up on top to get right in the supraspinatus and trapezius, rotator cuff muscle that is an issue, up into the side of the neck and the scalenes. Okay? And if I want to control the arm, I can take the arm up underneath like this, hold it, and then I can actually move the arm in different positions, internal rotation, external rotation, move it into abduction and adduction as I'm doing some laser treatments as well. Okay, and what's nice about this one is I can still do this one on the side, right? But if I want to get into the back edge a little bit, I can have Josh turn over to your stomach for me, and then I can get into his rotator cuff muscle in the back. So come up from under here to get into the infraspinatus, teres major, teres minor, into the latissimus muscle, rhomboids. And if they have tightness in the mid-thoracic spine, maybe there's some restriction in mobility, I can actually do the laser therapy right in here to help loosen up the tightness in the deep stabilizer muscles of the spine. So I can cover a big area to loosen up the controllers of the shoulder. And then obviously you can do just one side if it's bothering you, or you can do both.